The plan to put mental health counselors in Louisville's 911 centers will not be in place for a little while longer. WDRB's Travis Ragsdale explains what city leaders want to see first. Travis?
It doesn't seem like anyone here on Metro Council is necessarily against this plan. They just want some finer details on this program.
What color was the Hyundai that he left in?
We've done a lot of research and looking into what other programs exist and how they are unique.
Back in October, this program was first announced. Partnering with 7 county services, LMPD and dispatchers with MetroSafe would try to divert or deflect mental health calls away from police.
A lot of those crises can be de-escalated over the phone because some people, they may not have had anybody to listen to them.
7 counties would place mental health specialists in Louisville's 911 center so that when calls come in of a person in crisis, those with experience can respond and determine what that person needs the most.
This is the kind of de-escalation work that we've been doing for 50 years this year.
The pilot program was slated to start in January, but it's hit a bump in the road. At last week's Metro Council meeting, members voted to table the contract. Why? Because some felt that the requirements to do this job weren't tough enough. As the contract was written, the job required someone to have 6 months' experience.
Because I think it's a concern when we're thinking about the level of skill needed to carry out this work with fidelity.
There were also issues raised about how to track the success of the program. 7 counties says its goal is to reduce LMPD's response to people in crisis by 60%. It's clear no one on Metro Council is against the program, but they are asking for stricter job requirements and tracking before it votes to fund it.
Council says it hopes to have a new contract in place and voted on by its first meeting of the new year in January. We're live in downtown Louisville. Travis Ragsdale, WDRB News.
All right, Travis, thank you. And